Hi everyone, my name is Emma Euland and I'm a fourth year pharmacy student at Cone Health, and today I'll be sharing pharmacy updates for the month of July 2021. In this video, we will cover medications that have recently received FDA approval, provide FDA news updates on the use of statins in pregnancy, highlight new data published in advanced kidney disease and severe asthma, and finally discuss a novel diabetes medication pending FDA approval. First, I will review two new medications, Kerendia and Vaxneuvance, that have received FDA approval this past month. We will start with Kerendia, which is the brand name of finerenone, a nonsteroidal selective mineralocorticoid receptor, or MR, antagonist. It acts by blocking sodium reabsorption and MR overactivation in the kidney, heart, and vessels, and is thought to be as potent as spironolactone and more selective than eplerenone. As a brief overview, the mineralocorticoid receptor overactivation is believed to contribute to fibrosis and inflammation that lead to progressive kidney and cardiovascular dysfunction. Unlike other MR antagonists like spironolactone and eplerenone that are mostly distributed in the kidneys, finerenone is equally distributed to the kidney and heart, which is thought to provide relatively more cardiac versus renal protection. Finerenone was studied in the Fidelio-DKD Phase 3 clinical trial, which compared finerenone to placebo in patients with diabetes and advanced CKD who were on maximally tolerated RAS blockers. The intent was to include patients who are at risk of CKD progression despite receiving standard of care treatment to control both blood pressure and blood glucose. Finerenone demonstrated significant reductions in the risk of cardiovascular outcomes and also slowed the progression of kidney disease. While adverse events were similar across groups, patients receiving finerenone experienced twice as many hyperkalemia-related adverse events compared to placebo. Next, we will discuss a newly FDA-approved 15-valent pneumococcal vaccine for adults aged 18 years or older called Vaxneuvance. As a quick recap, the CDC recently changed its recommendation to instead participate in shared clinical decision-making for adults older than 65 years who have never received a dose of PCV13 and who also do not have an immunocompromising condition, CSF leak, or cochlear implants. So what makes Vaxneuvance unique compared to currently existing options? You're likely familiar with the Prevnar 13 vaccine, which provides coverage against 13 Streptococcus pneumoniae serotypes. This novel vaccine provides additional coverage against two serotypes, 22F and 33F. Through data presented in 3 clinical trials, New Age, New Path, and New Day, Vaxneuvance appears to have a comparable immune response to Prevnar 13 for the 13 shared serotypes, but demonstrates a higher immune response for serotypes 22F and 33F. While Vaxneuvance demonstrated similar safety and tolerability profiles compared to Prevnar 13, we don't have adequate and well-controlled studies yet in pregnant or breastfeeding women to inform vaccine-associated risks in pregnancy. Next, we will discuss the updated recommendation from the FDA regarding the use of statins in pregnancy. In late July, the FDA requested removal of the contraindication for statin use in pregnancy after reviewing data from case series, prospective, and retrospective cohort studies. The most recent 2015 Medicaid cohort linkage study of around 1,100 statin-exposed pregnant women compared to almost 900,000 controls showed no significant teratogenic effect with the use of statins in the first trimester of pregnancy. There were no significant increases in the risk of congenital malformations between those who took statins in the first trimester and those who did not. There were also no significant increases in any organ-specific malformations. So what does the FDA recommend? In most patients, statins should still be discontinued once pregnancy is confirmed, with the exception of high-risk pregnant patients where the benefits of a statin outweighs the risk. In this case, the FDA encourages shared decision-making between the patient and healthcare professionals. Patients with unintended exposure to statins in early pregnancy should be reassured that the drug is unlikely to cause harm to the developing fetus. Up next, we will briefly discuss recently published data involving dapagliflozin's use in advanced kidney disease, as well as evidence for a new biologic in severe asthma. As you may already know, dapagliflozin became the first SGLT2 inhibitor approved for the treatment of adults with CKD, regardless of their diabetes status, in May of this year. This approval was based off of data from the DAPA-CKD trial, which we will discuss further. This past month, investigators from DAPA-CKD trial performed a pre-specified analysis to examine dapagliflozin's efficacy and safety in patients with more advanced or stage 4 chronic kidney disease at baseline. When used in this advanced kidney disease population, dapagliflozin had similar benefits that were observed in patients with less severe or stages 2 through 3 disease without imposing any additional risks or side effects. Of note, there was a transient eGFR drop in the dapagliflozin group 2 weeks after initiation, which eventually recovered. However, the most notable fact was the flattening rate of kidney function decline in the dapagliflozin group across stages 2 through 4 kidney disease. Since neither placebo or dapagliflozin were discontinued when eGFR declined, even to as low as 15 mL per minute, it appears that a dip in kidney function doesn't warrant the discontinuation of dapagliflozin. Next, we will discuss a novel asthma biologic, tezepelumab, that was granted FDA priority review for the treatment of patients with severe asthma. Tezepelumab is a potential first-in-class human monoclonal antibody that inhibits a key inflammatory cytokine, TSLP, that's released in response to asthma triggers. This unique mechanism targets both allergic and non-allergic components further upstream, which likely dampens the typical overactive inflammatory response regardless of eosinophil count. Tezepelumab was studied in patients with severe uncontrolled asthma in the Navigator trial, which is the first phase 3 trial to show benefit in severe asthma regardless of eosinophil count. When added to standard of care, tezepelumab demonstrated both statistically significant and clinically meaningful reduction in the annual asthma exacerbation rate compared to placebo. Patients in the tezepelumab group also experienced fewer side effects. And while these benefits were seen regardless of eosinophil count, the greatest improvements were seen in patients with an elevated level. In the future, this new biologic will likely be used in severely asthmatic patients who have failed previous biologics, regardless of their type of inflammation. Lastly, we will discuss a new anti-diabetic agent that is currently pending FDA approval. This new drug, tirzepatide, targets glucose-dependent insulinotropic polypeptides, or GIP, as well as GLP-1 receptors. Like most other GLP-1 agonists, tirzepatide is a once-weekly subcutaneous injection and can titrate up to 15 milligrams. Tirzepatide was studied in the phase 3 SURPASS-2 trial, which compared varying doses of tirzepatide to 1 milligrams of semaglutide in patients with type 2 diabetes. Overall, the tirzepatide groups experienced a greater reduction in A1C and weight compared to semaglutide. The greater than 2% A1C reduction surpassed the semaglutide group by up to half a percentage point, and weight loss almost doubled that of semaglutide. Tirzepatide exhibited mostly transient GI side effects, as expected with most GLP-1 agonists. Pending approval, tirzepatide will likely be considered as a more effective alternative to GLP-1 agonists in both A1C lowering and weight loss. To recap, today we discussed the newly approved Kerendia and novel 15-valent pneumococcal vaccine, Vaxneuvance. We also discussed the FDA's removal of statins contraindication in pregnancy. And lastly, we discussed compelling data for dapagliflozin, tezepelumab, and the dual mechanism tirzepatide. Thank you so much for tuning into this presentation. This concludes your July 2021 pharmacy updates.